Hi, my name is Blakely Graham, and I'm going to be doing the screening cardio exam. How are you feeling?
Good.
Okay, I'm just going to look at your hands.
Okay.
See if there's any color changes or any other abnormalities. Okay, and now I'm just going to check for capillary refill. Okay, and now I'm going to palpate the radial artery bilaterally.
Okay.
Okay, and then could you lay down for me? Just going to look at your legs for any color changes as well. Also checking for the hair distribution. Okay, now I'm going to check for pitting edema over the tibia. Okay, and now I'm just going to palpate the dorsalis pedis bilaterally. And also the posterior tibial bilaterally behind the medial malleoli. Okay, and now I'm just going to evaluate for JVD.
Okay.
If this table would, or if it would elevate, I would have it at about 45 degrees. But
Okay.
since it can't do that, I'll just have you look that way for me.
Okay.
And just inspect it. Okay, and now I'm just going to auscultate your carotids. So if you could just take a deep breath and hold it for me. Okay, and let it out.
Okay.
And then just look this way and take a deep breath and hold it. Okay, you can let it out.
Okay.
Okay, now I'm just gonna listen for your heart sounds.
Okay.
Okay, and can you lift your breast for me? Okay, and can you turn on your left side for me?
Yep.
I'm just gonna listen to the heart sounds again. Okay, and if you don't care, could you lift your breast for me again? Okay, and just keep it lifted. I'm just going to palpate in that same area
Okay.
for the PMI. It's about at the 5th intercostal space, medial to the midclavicular line.
Okay.
Okay, and it's right there. Okay, now I'm just going to have you sit up.
Okay.
And I'm just going to listen to your lung sounds now.
Yep.
Each time my stethoscope touches your chest, do you care to take a deep breath in and out of your mouth? Okay, and just turn around for me.
Okay.
And if you don't care, just lift this right arm.
Okay.
Okay, and a deep breath in and out. Okay, and I'm just going to do the same thing here on your back, okay?
Okay.
In and out of your mouth. Okay. And now I'm just going to perform a structural exam.
Okay.
So I'm just going to palpate down your spine and see if there's any restriction in motion.
Okay.
Okay, and I'm just going to do the same thing on this side.
Okay.
Okay, and I did identify some restriction in the T2 to T4 area on this side.
Okay.
Now I'm just going to have you lay flat for me if you don't care.
Okay.
And I'm just going to listen to your abdominal vessels.
Okay.
It'll be 3 points above your belly button and 2 below.
Okay.
Okay. And I can help you sit up.
Okay. Thank you.
Hi, my name is Leah. I'm going to be your student nurse today. How are you?
I'm good. How are you?
Good. Can you tell me your name and date of birth?
Mackenzie Villalbazo, 21501.
Okay, thank you. Are you in any pain today? Okay. Do you have any family history of heart disease?
No.
Okay. So I'm going to be doing a cardiac exam today. So I'm going to be listening and palpating on your chest if it's okay.
Yes.
Okay. So general survey, patient is alert and oriented, sitting up, tan and skin color, and pleasant. Alright, so I'm just going to start by palpating your carotid artery. Okay. They are symmetric bilaterally and 2 on the scale. And then I'm going to listen to the carotid arteries again for bruits. Sorry. When I first say, can you hold your breath when I place the stethoscope? Okay, thank you. Breathe. Do the other side and then hold your breath. Alright, so there are no bruits present. Now I'm going to palpate for the apical impulse, so the left midclavicular line and the 5th intercostal space.
You can lean back if it's easier.
Okay. So that is present, and then I'm going to listen to the 4 valves. So that's aortic, pulmonic, tricuspid, and mitral. I'm going to listen to the same 4 places with my bell, but for those first 4, S1 and S2 were present. So S3 and S4 weren't present, there were no murmurs or gallops. And then I'm just going to listen to your apical heart rate for 60 seconds. So I got 67, and the rate was regular for them. So can I get you anything? Nope. Okay, thank you.
Hello, my name's Anna. I'll be your student nurse today. How are you doing?
I'm good. How are you?
Good. Could I please have you repeat your name and date of birth back to me?
Audrey Davis, 11/20/02.
Okay, perfect. And today I'm going to be doing a cardiac exam, and I'm just going to be like taking some of your pulse like in different spots and just examining. Is that okay with you?
Mm-hmm.
Okay. Do you have any family history of heart disease?
No.
And do you yourself have any history of like a heart murmur or defect?
No.
Nope. Okay. So I'm going to get started by palpating your carotid arteries. Carotid arteries. Okay. Okay. Okay, so both of these pulses are symmetrical, and I would grade them a 2 on the scale. And so now I'm going to check for bruits with the bell side. Yeah, the bell side of my stethoscope. Okay, so when I put this on, I'm gonna have you take a deep breath and hold your breath. Okay. Okay, you can breathe. And then take a deep breath. And hold it. Okay, perfect. You can breathe now. All right, awesome. So there are no bruits bilaterally. And now I am going to, find your apical impulse, and it's going to be on your left side, mid-clavicular down 5 intercostal spaces. So if you don't mind. Okay, perfect. Okay, so now I'm going to auscultate just your whole diaphragm with my stethoscope. And I'm going to do that with the diaphragm side, so I'm going to flip it around. Okay, so I'm going to start with your aortic. Okay, now your pulmonic. Now your tricuspid. Sorry. There it is, and now your bicuspid. Okay, awesome. So the rhythm is regular, and there is a presence of S1 and S2 beats, which are the lub and dub, and there are no presence of S3 and S4. And now I'm going to listen to the valve areas of with my bell side, and I'm going to listen for like gallops or murmurs or anything like that. Okay. Okay, aortic, pulmonic, tricuspid. I have a hard time getting this one. Okay. And then bicuspid. Okay. I can hear your stomach a
I
little
know,
bit.
I'm hungry.
Okay, cool. So there were no murmurs or gallops or S3 or S4 heard. And so now I'm going to take your heart rate and so I'm just gonna take it for 50 seconds or for 60 seconds.
Okay.
With the diaphragm. Okay. Okay, so the patient's apical heart rate is 64, and that's all I have for you today. Can I get you anything else? Are you doing okay?
Mhm.
All right, awesome. Have a great day.
Thank
Now
you.
just wash my hands again.